What are the articles you need to know from the CFP Journal this month? It's December 2021, and I'm Dr. Simon Moore from the Review Course in Family Medicine. It's CFP Distilled, where we break it down and show you what you need to know. Key pearls from this month. Number 1, IBS and CBT. Is there a role? Number 2, let's take a look at the latest and greatest guidelines that have come out for your clinical practice and things to know for the exam. And number 3, what do we need to know for migraines? Brand new treatment. Let's dive right in.
Is CBT effective in children for those who suffer from IBS? And the answer is yes. CBT, whether it's internet-directed or internet-based, has been shown to decrease pain along with improved outcomes. So consider CBT in children with IBS. Read more in the article in this month's CFP Journal.
There are so many guidelines constantly coming out, so how do you know which ones that you need to study or be aware of for your practice? Well, take a look at the December 2021 CFP Journal. There's a great summary of key pearls from guidelines that have recently come out. Let's take a look. For example, number 1, you need to be aware of the new terminology and the new management for heart failure. Systolic heart failure, don't use that term anymore. The new term is heart failure with reduced ejection fraction if the EF is less than 40%. Second key point from this article, esophageal adenocarcinoma. Those patients, even if they've got GERD, we do not screen them for esophageal adenocarcinoma according to the Task Force on Preventive Healthcare. And a third one, if you've got folks who are 65 years of age or older coming into your clinic, check their pulse. Find out, are they irregular? Do they have a heartbeat that suggests they might have atrial fibrillation? We should be screening all those patients according to the new CCS AFib guidelines. So how do you keep up to date with all the guidelines coming out? Better way to do it, go to thereviewcourse.com/guidelines. That's where we compile everything you need to know for clinical practice and for the CCFP exam.
And we use biologics for absolutely everything. Some recent studies have shown that even for migraines, if oral medications have failed, first line, second line, third line, there are some biologics that are calcitonin gene-related peptide inhibitors, CGRP, calcitonin gene-related peptide inhibitors. Another thing you can add to your arsenal to consider when dealing with chronic migraines.
That wraps up CFP Distilled for December 2021. If you're studying for the CCFP exam, please take a look at our work at thereviewcourse.com, where we help you prepare. And we would love to see you again in January for the next month edition of CFP Distilled.